My name is Dr. Chris Gubbels, and I'm here giving you the Square One Health Tip of the Week. And we're doing a series where we're going to go over the 5 biggest causes of neck pain, as I showed in the previous video. And on this one, I'm going to go over one we see a lot. People don't think about it a lot, and that is when someone has lateral head translation like this. Basically, a lot of times that can be by an accident, a trauma, doing repetitive type things. We're going to see the spine actually shifted over to one side like that. It creates a lot of problems in the neck, probably a lot of problems in the arm quite frequently. And what I'm going to do is I'm going to walk through an example of that. Be one of my employees that's going to be acting as a patient. We're going to show you this, and we're going to show you the kind of treatments we do. And then I'm going to show you some pre and post x-rays and treatments of patients that we've actually treated.
Okay, so what I want to do, first off, is I'm going to review kind of what we're looking at, and I want to walk you through some of the treatments, and we're actually going to demonstrate what these treatments look like in our office. So this is an example of what we're going to be looking at. This is first thing we do when someone comes in, we have to give them an evaluation. We're going to look at the inside and the outside, meaning we're going to look at their postures. We're going to do a digital posture analysis, and I'm going to show you what that looks like to start. In this case, you can see this lady, her head is actually shifted over to the right. And once we know what we're treating, for example, we're going to do some different treatments. We're going to do exercises, we're going to do mirror image adjustments, and then we're going to do mirror image traction. So if the head is over to the right, we're going to do everything to bring it back over to the left. So in this example, you're going to see the person doing exercises to the left. Now, when we do these exercises, we always start off doing pain-free range of motion without any resistance. And we're going to have the patient do these in office and at home. And once they get up to a certain point where this becomes easier, then we're going to start adding resistance, where they would actually wear a band on their head and they're going to pull with some tension to strengthen the muscles. We're going to go over mirror image adjustments. You're going to see this. Basically, we're putting the head in the opposite position and we're adjusting. It's not usually going to cause cavitation, which is that the sound you're used to hearing, or people are familiar with chiropractic adjustments. They call it cracking, things like that. But you're not going to hear that cavitational sound. Basically, we're going to push the body in the opposite direction. It's going to stimulate the receptors, the proprioceptors on the joints, and it's going to help train and retrain your body how to hold itself in the right position. And the last thing we're going to do after adjustments, typically after adjustments, always after exercise, we're going to do traction. And what traction does is it holds the body in the right position, and it helps retrain the disc, ligaments. It helps reshape those things back to normal. So a great way to think about it: exercise works muscles, adjustments work on the neurology and the positioning, traction works on white tissues, ligaments and disc, and it helps reshape those. So in our example, we're going to have our rehab assistant, Aaron, and Aaron's going to go through what these exercises and some of the rehab looks like. Now, Aaron doesn't really have this problem, but just for patient protection, we're having him demonstrate and act as the patient here. So in this scenario, you can see his head is translated over to the right. And this is something we see quite frequently. You can see typically when this happens, his opposite shoulder is going to be higher on the left, his lower shoulder will be right. Some things you can look for if you're curious if you have this is, notice how his nose and his sternum, his nose is actually shifted over to the right compared to a sternum notch. His right shoulder is lower than his left, and you'll typically see the hands a bit lower on the side of translation compared to the left. Now let's get into some of the rehab that we would do for this.
Okay, so now Aaron's going to show you some of the exercises that we do for something like that. His head goes to the right in this example, so he's going to be shifting it over to the left. And he's going to work, he's tilting his head a little bit. We really want to keep that head nice and level. So that's some of the exercises we would do for a patient like this. And then the other thing that we do is we do mirror image adjustments. And so his head is, in this example, is going to the right. So I'm going to be pushing it back to the left. And we literally would just hold the spine down and do some light adjustments like this. And we're not trying to get any popping or any cavitations, but this is one of the ways we help retrain the body how to hold itself properly by pushing the body in the mirror image position, which is the opposite of what he is. This would be the over-corrected position. And when we give that adjustment, it fires off a lot of receptors, mechanoreceptors, and it uses proprioception. That's part of the way we retrain the body to hold itself in the right position. So what we're doing now is we have Aaron sitting here in traction, and if you look, you can see we're actually pulling his head over to the left, and we would hold it there for a while, and that's one of the ways we actually get some of the ligaments and other tissues to start readapting back to normal. And we would get him up to doing a maximum about 10 minutes like this. Aaron, go ahead and put your finger on your sternal notch so they can actually see. Yeah, that's a sternal notch if you look in there. So you can see he's got his finger right in the center, so you can see how far over to the left we're actually pulling that. And we would hold it there for a while, and that's one of the ways that we would actually help correct this.
So now what I want to do is I want to show you some pre and post x-rays that we've taken in patients that we've done this treatment for, patients that came in that had their lateral head translation. On this first one you see this is a before over here. It would be on your viewing left, and viewing right would be the after. And you can see the green line is normal, it's where we should be, and then the red line is the actual patient. So this was actually just something we did pre and post. It's a 6-week pre and post, so not a lot of time. We ended up doing a little bit more, but you can see just in 6 weeks the dramatic improvement we made pre and post. And then we did a little bit more with this patient because we weren't 100% done. But the patient needed just a little bit more care. We actually like to overcorrect a little bit because we know that's going to settle in a little bit. This is another patient, and this was someone we got just awesome results with. If you look over here, this is the person, their head is translating over to the left. So you're looking at this like you're looking at the patient. So this is the left, this is the right. This patient came in with lateral head translation of 13 millimeters, and that's quite a bit. And on the follow-up, you can see we actually overcorrected a little, which is exactly what we want to see. And if you can see the dates up here, it's really small. February 8th, 2016, February 25th. So that is just, over 2 weeks. This is incredible results. We don't always see things this fast. Probably because it was over, there's a little bit of intelligent posture. I mean, it was probably some shifting just because of pain. But this is the patient that was brought in by his mother. He's having a lot of back pain, neck pain, and this was one of the main causes of why. And you can just see the pre and post. And I did the post. We didn't do any traction, any rehab. When he came in our office that day, we did the re-exam. When I did his posture checks, I could see a big difference. So we did the re-exam without doing any treatment before we actually took the x-rays. So we know this is how he actually is at this point. So I just want to summarize some of the things we're looking for about these injuries and give you some data and some more facts on it. First of all, when we're looking at these kind of things, what we know is these things don't typically just happen on their own. They're typically caused by injuries, typically caused by accidents. In my own experience, most patients are not aware they have these things, and a lot of times they have a hard time recalling when this could have happened. But what we know is only about 9% of the people, the general person without an injury or accident, has these things. We know people that, for example, people that are in an auto accident. If you were in an auto accident, you've had a whiplash type of injury, like you've had a whiplash that has caused an injury, we know you're 5 times more likely to have a major malalignment like a lateral head shift in your neck and spine. We look at things, people get T-boned, you're hit from the side. When you get any kind of side impact in the body, what usually happens is the body shifts over and the head stays still. You get hit from the side and the head stays still. That causes a lateral translation injury. The thing about football, the amount of side impacts that people get hit from the side. You look at hockey, rugby, different kinds of sports, and you don't realize how that side impact shifts the body over, and the head is kind of like a swivel on a stick. A lot of times the head will stay in place, follow afterwards, and that causes the injuries. Other things we know is these things do not get better on their own. Typically, the longer you've had the pain, the older you are. Meaning, as you age, the pain usually is there longer. It keeps getting worse. It doesn't improve on its own with age. The other thing is, the older you are or the longer you've had this or this kind of pain, typically the worse the translation is. So not only does the pain stay there, the translation, the malposition is going to get worse over time, and the pain is going to get worse over time. And the further it gets, typically the worse the pain is going to be. A really interesting note is about 66%, about 2/3 of the people that have a translation, it's usually to their dominant hand. Meaning if you're right-handed,
the odds are on about 2/3 people you're going to translate to the right. If you're left-handed, it's going to go to the left. Now, in about 1/3 of people, we get a translation to the opposite side. So meaning if you're right-handed, right dominant-handed, about 1/3 of the population is going to get a translation to the left. Of interesting note though, if you're getting a head translation to the opposite side of your dominant hand, you only need a slight translation for that to cause pain and problems. Meaning, it doesn't have to be that bad. Typically, if you're translating to your dominant side, you have to have at least moderate, you usually have moderate translation for that to start causing symptoms and pains. You see this in athletes a lot like Peyton Manning. You look at Peyton Manning, his head shifts to the right. You see it in all the pictures. Look for it now. He had neurological problems down his arm, neck pain, those kind of things. So if you're someone who's had neck pain, you've had an injury, a car injury, or a sports injury, and the things that we are going through, if you didn't get that kind of evaluation when you went to someone, or if you didn't go to someone, you need to go to someone who understands this kind of stuff, who does this kind of treatment, and who's trained and has the equipment to do this kind of rehab and chiropractic treatment. Most chiropractors aren't trained in this kind of thing, but this is true corrective in nature. So if you live in Fort Collins, Colorado, and you have neck pain, or you know someone who's been in an accident, or you notice a shift in one of your shoulders, your head's going to the right, give us a call here at Square One, 970-207-4463. Give us a call. Tell us you saw us in the video. We'll set you up for a free consultation with one of our doctors. If you don't live in Fort Collins or Northern Colorado, and you need to find someone that does this kind of work, and the best place to go is go to idealspine.com. You can look for a chiropractor in your area. Best to find someone who's trained or is certified, advanced certified, or instructor. If you don't have one of those, you can still find other instructors who've had some of these courses.